When they tell you you have cancer, I mean, first you kind of go into shock, and then after that it's just frightening and overwhelming. Am I going to live? Am I going to die? Like, you don't really know. My name is Sandy and I'm from Port Coquitlam. I've lived there pretty much all my life, and in 2016 I was diagnosed with breast cancer. I had an appointment with a surgeon, and she gave me the options of either a lumpectomy or a mastectomy. When she gave me the odds, which were 1% in a year if I had the lumpectomy that it would come back, or 1% in 10 years if I had a mastectomy that it would come back, to me it was a bit of a no-brainer. The chances of surviving were just that much better to have the mastectomy. So I had a bilateral mastectomy a month after that. The reason I opted for both wasn't actually because it can come back on the other side. Obviously that can happen. But for me, I just wanted to look in the mirror and feel as normal as possible. Once they take the tumor out, of course, they send it to the pathologist, and when it came back, I didn't just have the ordinary run-of-the-mill breast cancer. it was go big or go home. I got the most aggressive breast cancer you could get. It is rare, they tell me. I had what's called triple negative breast cancer, which is very, very aggressive. So when they first discovered the tumor, they told me it was the size of a sugar cube. Now, when they took it out, it was actually the size of a golf ball, and that was in a year. That's why I always tell people it's very important to go for a mammogram, because even the surgeon and all my doctors who knew where the tumor was, they couldn't feel it. So doing self-breast exams obviously are a good thing, but in my case it didn't do anything, because even the people that knew where it was, they couldn't feel it either. For the few minutes that it takes, I mean, it can save your life, and I'm prime example. Like, it literally saved my life. Chemotherapy, obviously everybody knows it's not the most prettiest thing to do, and it was frightening. Because I had the mastectomy and I just figured, everything was gone, it was out of me, I was just having a really hard time wrapping my head around why I should put my body through all that. Luckily for me, I had met Dr. Gurm. I was sent here to Port Moody Health from my general practitioner, actually, because she knew that I didn't want to do the chemotherapy, so she thought that this was a good place for me to come just to look at alternative to the chemotherapy. Dr. Gurm actually did tell me, and she was adamant, very adamant, that I do the chemotherapy as well as in conjunction with the medicine that she was going to provide for me here. I still was having issues with that. That's why I went for the second opinion. And when that oncologist told me that if it came back I'd be dead in a year, I kind of said, "What day did you say my first chemo was?" And off I went. So I jumped in with both feet, and in I went. I had 16 rounds chemo. I did awesome through the whole thing. I had energy, and I chalk it all up to coming here and doing what I was doing with Dr. Gurm. I got up at 5:30 in the morning, I went to work by 5:15. I worked all day, usually till about 1 or 2. I continued to live life as normal as I possibly could, which to me, I think kept me sane. So I did the vitamin C drip 3 times a week. I did the Elixir as well 3 times a week. I also did the hyperthermia bed, as well as, of course, the chemotherapy in conjunction with. I almost felt guilty because I didn't feel sick. People didn't believe me when I told them that I was going through chemotherapy. They're like, they just really didn't believe me. And I'm sure that it is because of all the integrative medicine that I did in doing everything in conjunction with, just gave me that much better quality of life. So I took advice from Sharon, and I took advice from my general practitioner, of course, and I took advice from my oncologist, and carried on. I was lucky that my doctor sent me here. A lot of people don't know, and a lot of people actually don't spend the time to research what's going on. They just go with what they're told to do. It worked out because, of course, I'm now 2 years cancer-free. If you have a good support team behind you, and coming here, they are all, from Dr. Gurm to the staff, everybody is very supportive. It's like, that you can tell that they really care. And now I'm actually down to once a month for vitamin C drip, which is great, and Helixer, but I do that now for prevention, obviously, but mainly just for general health. And of course, it keeps your immune system strong, and as long as your immune system's strong, then, hopefully I'll be around for another 50 years. I always have to look at the bright side of everything. There is always a bright side, like losing your hair. Yes, it was very emotional, but I didn't have to shave my legs for 6 months. Yeah, there's an upside to everything, right? So being deemed cancer-free in 2 years, I think, is awesome. It's, best day of my life. It really helps to know that people care and that they're not judging you by the decisions that you're making. Dr. Gurm, her passion for healing people is contagious. She really is phenomenal. The best advice I could give would be just have a positive attitude. Don't look at it as a death sentence. You have to believe in your heart that everything will work out the way that it's supposed to work out. And if you have a positive attitude going into it and you believe that you're going to be cured, then in my mind you will be cured. So surrounding yourself with positivity and people that are also positive and aren't going to bring you down, that is the best medicine that I think that you could do. I won't lie, it really is frightening. And you do have those thoughts, like, am I going to survive? But you will, and you do. I truly believe in what Dr. Gurm is doing. I believe in her passion for healing and the caring that she has for people. And I knew that she was giving me the best advice that she knew that would help me and to become a survivor. And that is why, she is a big reason why I did the chemotherapy. Because if I didn't come here, I probably wouldn't have. So I don't know what that outcome would have been. But yeah, her passion for healing and for caring people goes a long way, absolutely.